So we've tested 3 different types of damage to the eye. The first one we did was a Hail Mary. So a lab near ours across the road works on rejuvenating the spine and the optic nerve. Yeah, because we know as soon as you're a couple of months old, you're not going to regrow a spine. It's one of the first parts of the body that ages. But jellyfish can regrow, axolotls can regrow an arm. We lose that ability when we're very, very young. The question was, if we turn the clock back a lot with our OSK genes, will those nerve cells be young enough to regrow back to the brain if we damage them? And that was the experiment. They pinched the back of the optic nerve so that the nerves were defective, and they started to die back towards the brain. Of course, the mice lost their vision. We then turned on our reprogramming factors. We now see that the nerves get young again, wind the clock back, and they regrow back to the brain. We could give ourselves the healing ability that we only had when we were embryos. And you start to think about, what could this lead to? If we can do this safely, of course safe is the important word, across the body. Imagine one day you could have every cell in your body able to be rejuvenated like that. You cut yourself, you break a bone, you lose your mind, you have a dementia. You take a course of doxycycline for a few weeks and then stop, switch it off again, and you heal. If you turn it on at high levels, there's a lab in Spain that has shown that you can get small tumors in some animals in the kidney. We've been very careful to not just blast the cell with these factors permanently. We've titrated, or what we say, brought the levels down to very low levels and switch it off when we don't need it. But we have given mice this virus throughout their body. We inject it into a vein and we turn it on. We've left it on now, expecting the mice to die. A year later, they're perfectly fine. So it appears to be safe, but of course there's a lot more work to do. I'm a scientist and I'm developing drugs. Have to be very aware of the dangers.
Sure.
Please, nobody go out and try this at home at all until we know more. But the eye is a good testing zone because it's protected, and if there's a problem, it's shielded from the rest of the body. It won't go too far. But everything we know now is that it seems to be very safe, at least in the eye.